Hello and welcome to Vlog 1 Weightlifting Module SAC 7108. So throughout the presentation the squat and hang clean movements will be analysed and are being performed by a range of athletes, and we're going to be identifying errors and seeing if they stem from a skill or capacity issue, and from that appropriate solutions will be recommended. Before continuing any further, it is worth defining skills and capacities. So a skill reflects an athlete's ability to control their body accurately, efficiently, and in a timely manner, whereas capacities are the athlete's ability to express a given quality, for instance force production and range of motion. But it is worth noting that many improvements in skill will be made through intangible adaptations, whereas capacity improvements are more tangible, such as a new 3-rep max as a result of increased force production. But it is a solid base of capacities which allows skills to be completed effectively and efficiently. However, it is difficult to determine where a skill ends and the capacity begins. With this in mind, we are introducing one of the key messages which will be reiterated throughout the presentation, which is that skills and capacities are inseparable. So, we know that squatting is a complex multi-joint movement requiring forces to be transmitted efficiently through the trunk to the body's extremities. The main issue seen here is flexion of the thoracic spine at approximately 120 degrees of hip flexion. This implies that they have a restriction in the posterior fibres of the iliotibial band, or simply a lack of lumbar control. The causes of trunk flexion are most likely from a weakness in the erector spinae and reduced tension in the thoracolumbar fascia through the integration of the posterior chain and back musculature. But it is worth noting that interventions should focus on surrounding musculature rather than focusing on a single muscle group, which is why the core should be strengthened also. Another secondary issue is that of insufficient hip mobility, potentially caused by tight connective tissue. And the following corrective exercises are clearly aimed to strengthen the spinal extensors, to open up the hips, and to get the athlete used to achieving the deeper range of motion in the squat. Okay, and now we're moving on to our second athlete who has a skill issue during the squat. And it actually starts with the athlete complaining about lower back pain. And as you can see on the video, we have the main issue of excessive cantilever lean. This results in an anterior trunk lean, which places force distribution away from the knees and places excessive forces on the hips and lumbar spine. This is evident by the back angle at the bottom of the squat being far more acute than the angle of the tibia. Now, screening has shown that the athlete has an ankle range of motion of 12 centimeters on both legs. Perhaps then, the main focus, rather than being on tight or weak muscles, it can be argued that certain variations of squatting are better suited to some lifters than others. It is well known that longer-limbed people will struggle to squat due to the relative length of the femur. The differences of femur length are shown in the diagram on the right-hand side, with A being a long-limbed person and B a short-limbed person. Our athlete here was found to have a torso measuring 17 inches and leg length measuring 37.5 inches. This makes it harder for this athlete to squat without a cantilever lean during a high bar squat. Therefore, it is recommended that we allow training variations that reduce unnecessary stress on the athlete. These variations include low bar squatting, wider feet positioning, and weightlifting shoes. The diagram shows the intervention of low bar squatting and weightlifting shoes on an athlete with long limbs. And what we see is less stress on the back and hamstrings due to the reduced cantilever lean, and also the centre of mass brought a little further back now towards the midfoot of the athlete. We should note, however, that the wide stance requires good flexibility of the adductor muscles and adequate structure of the coxofemoral articulation. Therefore, not everyone can perform this type of squat. To summarise, no ideal squatting pattern exists that can be generalised to the whole population, but when the athlete's context and morphology is considered, we can see that the proposed solutions result in a more ideal squatting pattern that can not only reduce the risk of injuries and secondary pain syndromes, but may also improve sports performance. And now we are moving on to the hang clean with a capacity issue. So, following a good starting position with minimal change in trunk angle and shoulders over the bar, the athlete does show insufficient hip mobility between the unweighting phase and second pull, when there is no contact of the mid-thigh with the bar and triple extension is not achieved. Taking a closer look at one rep, we can see the athlete is not coordinating the knee and hip extension in an optimal way, resulting in poor transfer of forces to the bar, and they may feel like they are using their hips, but they are more rocking onto the balls of their feet and shrugging a lot with their arms. In fact, on this particular rep, the athlete lands on their front foot and struggles to get under the bar also. This athlete does have a history of stiffness in the hip, but unfortunately their hip flared up and the athlete was not available to be screened for the purpose of this video. That said, the largest improvement to this athlete's skill execution would have been improving hip flexibility. Exercises that can be used include one of the exercises shown previously, and also the glute bridge. The final exercise will be the hang clean with a skill issue. And this time, what we are seeing is thoracic flexion at the start of the first pull. During the first pull with thoracic flexion, this results in increased load through the spine when the bar is over the knees. This means that the bar is far away in front of the body, and from this position it is hard to use the hip extensor force capabilities to effectively use the stretch shortening cycle. This is a problem because hip extension is relied upon heavily during the early phase of the jump, followed by the knee and ankle. The cause of this issue is predominantly skill related, and the athlete is attempting to solve a movement challenge, but they have a perception that when the legs are mostly straight, there is difficulty jumping. I would argue the athlete needs to practice the skill as a means of improving muscular contraction regimes and neuromuscular patterns. From a coaching perspective, one approach could be the use of part and hold practice. This could include Romanian deadlifts, hang cleans, cleaning from blocks, and cleaning from the floor. It is also important not to overcoach this movement as well. To summarise, this assignment asked me to identify if a movement's shortcomings were due to a skill or capacity issue, when in fact all the exercises have been restrained by a mixture of both, and it is the context which determines which factor is more prevalent.